los participantes del comité directivo 58º comité directivo de la OPS. Les damos un especial saludo en este segundo día de sesiones y esperamos que sea lo más fructífero y provechoso. Quisiera en primer lugar pedirle a la señora secretaria, a la secretaría, que nos indique el quórum existente.
Thank you, Mr. President. Good morning, everyone. Yes, Mr. President, there are delegates from 28 member states clearly identified and connected to this virtual platform. It is my pleasure to inform you that indeed there is a quorum for this session. Thank you, Mr. President.
Muchas gracias, secretaria. Pasaríamos a Mónica por si hay algún tipo de anuncio. Por favor, confirmar. Mónica, adelante.
Muy buenos días, delegados. Buenos días, presidente. Sí, algunos anuncios generales. El primer sería que los cambios a resoluciones recibidos ayer hasta las 2 de la tarde fueron circulados en el idioma original a todos los delegados a las 4:42. Las traducciones a los 4 idiomas fueron circuladas a las 7:57. Esta mañana hubo una consulta informal sobre el tema del COVID-19 que ha avanzado las negociaciones sobre el texto de la resolución. Esta consulta informal seguirá en la hora del almuerzo con el objetivo de consensuar un texto final para la resolución de COVID. Quisiera también informarles que los cambios discutidos sobre la propuesta del tema 5.6, modificaciones del reglamento financiero y reglas financieras de la Organización Panamericana de la Salud, también fueron publicados ayer en el web como Addendum 1 y también fueron distribuidos, circulados por correo electrónico a los participantes también ayer por la noche a las 8:30. El programa de reuniones para esta mañana también fue publicado ayer por la noche y el programa como planteado es... esto, Jaime, por favor. Solo para que estemos todos en la misma página. Gracias. El programa será item 5.
The program is 5842, item 71, item 33, item 61, and if there is time, we will get into item 44. Thank you very much, Mr. President. Thank you, Monica. Thank you for this important information. Having concluded that point, we can begin this morning by discussing item 5.8, review of the charge assessed on the procurement of public health supplies from member states. Here, we will be referring to document CD 58/15, and I would call on the representative of the Executive Committee for him to report. Mr. Chairman, you have the floor.
Mr. President, the Executive Committee reviewed the report on the charge assessed on the procurement of public health supplies during its 166th session in June and considered a proposal by the Bureau to change the composition of the charge in order to ensure that the administrative costs associated with operating the organization's procurement funds are fully covered. In the committee's discussion of the proposal, delegates highlighted the important role of the procurement funds in improving the health of the peoples of the Americas. Delegates also expressed appreciation for the Bureau's efforts to ascertain the true operational costs of supporting the procurement activities financed through the funds and acknowledge the need to ensure that the Bureau is able to recoup those costs. However, one delegate was concerned that reducing the capitalization component of the charge might compromise the ability of member states to access lines of credit and benefit from pool procurement activities in a timely manner. She suggested that it might be preferable to raise the charge by 0.5%, which would make it possible to increase the administrative component without reducing the capitalization component. In response to that suggestion, it was explained that the Bureau considers it important to maintain the fee at its current level in order to ensure that member states' ability to procure vaccines and other supplies through the funds is not negatively affected, especially in the context of the current pandemic. The committee was informed that the Bureau is confident that it has an accurate picture of the personnel costs of operating the funds and that it can continue to improve the efficiencies of its operations over the long term, for example, by digitizing certain processes. In the light of those explanations, the committee decided to endorse the proposed change and adopted Resolution CE166.R3, recommending that the Directing Council approve the proposed adjustment to the internal composition of the 4.25% fee, increasing the administrative component of the fee to 1.75% and decreasing the capitalization component to 2.5%. Thank you, Mr. President. This concludes my report on this item. Over.
Muchas gracias, presidente. Invito al señor.
Thank you very much, Mr. Chairman. I would call on Mr. John Fitzsimmons, who is in charge of the revolving fund for vaccination purchases.
Mr. President, Madam Director, Directing Council members, I have two short slides to share with you, if you allow me to share my screen. Okay, good morning, everyone. This is in reference to review of the charge assessed on procurement of public health supplies for member states. As mentioned in or referenced in CD 52R12 from January 2014, the Bureau is requested to report on the use of the 1.25% at the end of each biennium. And so today, and as reported earlier, we're providing an update on that report of expenditures closing the biennium 2018 to 19. So you can see, as presented in the report, expenditures of $14.5 million. This considered only the cost of headquarters personnel who devoted 70% of their time to our operations for the revolving fund for access to vaccines, strategic fund for public health supplies, and the reimbursable procurement fund. Our internal analysis, however, towards the end of the period revealed that the cost of those operations could have reached $20.5 million during the period. And looking ahead, in follow-up to that analysis, we project that on a recurring basis for the new biennium that those costs would increase to $24 million as a minimum. Our report also outlines the progress achieved during the period 2018 to 19. to sustain access by member states to quality life-saving vaccines and strategic health supplies. Both the director's report yesterday and the financial report yesterday emphasize those different aspects of member states' utilization of the procurement funds. In addition, as was just mentioned, there's an ongoing process internally to transform our demand and supply management tools, to simplify, automate processes, and to establish digital platforms to continue to improve the value that these funds provide to member states. So our current request, and the one that was referenced by the executive committee, is to work within the overall fee of the 4.25% by reducing the amount that is credited to the capital accounts from 3% to 2.5% and increase the amount that corresponds to the special fund for program support from 1.25% to 1.75%. Thank you, Mr. President. And we're available for any additional questions that there may be. Over.
Muchas gracias, señor Fitzsimmons. Ahora le
Thank you
concedo
very much, Mr. Fitzsimmons. Now I offer the floor to the plenary.
Estados Unidos tiene la palabra.
The
Adelante.
United States has the floor. Please go ahead. And let's remember, we have 2 minutes for comments.
Good morning. The United States has no objection to the proposed change in the internal composition of the 4.25% charge on procurement activities. We encourage PAHO to continue to provide continued full transparency on this subject through further progress reports to the Executive Committee. Thank you, Mr. President.
Muchas gracias. Estados Unidos tiene la palabra Honduras.
I thank you, United States. Honduras has the floor. Thank you, Mr. President. Honduras agrees with the document CD 58/15, which is review of charge assessed on the procurement of public health supplies for member states. We realize that there has been an increased demand for access to vaccines, and that has increased the administrative, operational, and personnel expenses. And that is the result of the greater demand in the last 2018-2019 biennium. We realize that there is an ongoing need to provide sustainability and improvement to the 3 procurement mechanisms. These are procurement mechanisms that are vital to Honduras. In fact, in this country, we buy all vaccines used by the public sector through the revolving vaccine facility, in keeping with our legislation, and we have used the capitalization account of the revolving fund. Now, WHO, through this procurement mechanism, we use this mechanism for HIV, malaria, and other infectious diseases. We consider it timely, Mr. President, to approve this proposed resolution, CE 166R3. We trust that the Pan American Sanitary Bureau will maintain this procurement mechanism operating efficiently so as to contribute to member states in keeping with the principles of Pan-Americanism and equity to leave no one behind. Thank you very much, Mr. President. Thank you, Honduras. I recognize Canada. Canada, please go ahead.
Good morning, Mr. President. Thank you very much. I would like to thank the Secretariat for this report. Canada is a strong supporter of the pool procurement activities carried out by PAHO. Although we do not use them, Canada recognizes that PAHO's procurement is a critical mechanism for improving the health of the peoples of the Americas. As such, member states should ensure that the mechanisms remain self-sustainable and that the Secretariat is able to recoup the full costs associated with providing this important and valuable service for the region. Thank you very much, Mr. President.
Muchas gracias, Canadá, por su intervención.
Thank you, Canada, for your remarks. I now recognize Colombia. Colombia, please go ahead. Thank you, Mr. President. We want to express our appreciation to the Secretariat for the report that was presented. It allows us to have a clear view of the need to adjust the charges associated with the 3 procurement mechanisms of the organization. And these are mechanisms that are especially important right now for vaccines. We are mindful of the efforts made by PAHO, making sure that there will be enough resources available to cover operational costs, especially the activities of technical cooperation and investment projects. We highlight the need to continue to receive technical assistance from the organization in these areas. As we have done previously, we would like to underscore the importance of having the organization continuing to implement efforts to increase administrative efficiency so as to be able to attain the objectives set by PAHO. And it is important that we assure that there be resources available for technical assistance and financing from member states. We hope that the organization will continue to make certain that the mechanism is available for procurement, especially taking into account the current COVID emergency, which, along with other phenomena like the migration out of Venezuela, could mean that the countries are going to have to resort to the capitalization accounts to get faster and urgent access to services of public health that are required to address the emergency. So, Mr. President, we have no further comments or observations regarding the proposed resolution under discussion. Thank you, Colombia. Thank you for your intervention. I don't know, Mr. Fitzsimmons, if you have any comments.
Just to express our appreciation for all the support just mentioned, and to indicate that in the coming months and year, as we face the introduction of COVID-19 vaccine, that we will all need to redouble our efforts to ensure access in an equitable manner to this new vaccine. Here at the Bureau, we will be doing everything in our power to help ensure that. Over.
Gracias, señor Fitzsimmons. ¿Tiene la doctora Etienne, la directora, tiene alguna intervención? Adelante, directora.
Director Etienne, do you have any comments? Please go ahead.
And good morning to all. Very briefly, I would like to thank member states for supporting this resolution. The revolving fund for vaccine and strategic fund for medicines and medical supplies are important part of our technical cooperation in these areas. And as Mr. John Fitzsimmons just said, as we face COVID-19, these funds have become more and more important to assist in the technical cooperation. We will continue to look to ensure greater efficiencies and to serve member states to the highest standards. Thank you. Over.
Thank you very much, Madam Director. I offer the floor now to the plenary for any comments you may have.
Muy bien, no habiendo comentarios.
There appear to be no comments. Rapporteur, did you wish to speak? Rapporteur, please present the draft of resolution. You have the floor, sir. Mr. Rapporteur, thank you. We hear the rapporteur very badly, the interpreter points out. Very soft transmission. Under 5.8 of this agenda, we are looking at a review of the charge assessed on the procurement of public health supplies for member states. The document is the 58th Directing Council document CD 58/15, and the resolution reads as follows. The 58th Directing Council, PP1, having considered the review of the charge assessed on the procurement of public health supplies for member states, document CD 58/15, recognizing the increasing demand from member states for access to vaccines and strategic public health supplies, and noting the transformational project that Pan American Sanitary Bureau has undertaken to improve demand and supply management tools, to leverage technology that can simplify and automate processes and improve quality and speed, and to establish digital platforms that deliver real-time information to member states. 3, noting that the expenditures on operation of the 3 procurement managers in the biennium 2018-2019, the revolving fund for access to vaccines, the revolving fund, the regional revolving fund for strategic public health supplies, regional fund, and the reimbursable procurement on behalf of member states showed an increase of 74% increase over the period, and that an internal analysis of the full cost of personnel time, both at PAHO headquarters and PWR offices, estimated the actual personnel cost for operation of the procurement mechanisms at approximately $20.5 million. 4, noting with concern that there is an ongoing need to ensure sustainability of the 3 procurement mechanisms, considering the full costs of technical cooperation activities and investments to improve the quality and efficiency of service. The service charge, I beg your pardon, from 125% to 175%, and decrease the capitalization component from 3% to 250%. Resolves to authorize the director to do the following. A, adjust the internal composition of the 4.25% fee to increase the administrative component of the service fee to 175%, and decrease the capitalization component to 2.50%, effective 1 January 2021. This change will apply to the 4.25% fee on net purchases made by the revolving fund, the strategic fund, and the reimbursable procurement mechanism. B, credit the increase in the administrative component, 0.50%, to the special fund for program support costs to defray the operating and management costs generated throughout the organization by the revolving fund, the strategic fund, and the reimbursable procurement mechanism. C, decrease by the same percentage, 0.50%, the credit to the capital accounts of the revolving fund, the strategic fund, and the reimbursable procurement mechanism. That is the draft resolution before us, Mr. Chairman. Thank you very much, Mr. Rapporteur. Let me offer the floor for any comment.
No habiendo ninguna intervención.
There appears to be no request to the floor. I hereby declare this draft resolution adopted. This leads us to 4.2, item 4.2, COVID-19 pandemic and the region of the Americas. And here, let me point out to you document CD 58/6. And I would invite the representative of the executive committee to give us the necessary report. You have the floor, Mr. Chuck.
Thank you, Mr. President. After hearing 2 presentations on the COVID-19 situation in the region, the executive committee commended PAHO's leadership of the regional response to the pandemic and expressed thanks for the assistance and guidance that the organization has provided to countries. Delegates highlighted the need for a whole-of-government approach to address the pandemic's social and economic consequences, as well as its impacts on health and health systems. The importance of strengthening health systems and ensuring continuity of care for health problems other than COVID-19 was stressed. Several delegates underlined the importance of adhering to the international health regulations and sharing information in a timely and transparent manner. Pan-American solidarity, partnership, and cooperation were seen as critical to controlling and ending the pandemic. It was emphasized that COVID-19 is a regional problem, not a national problem, with one delegate pointing out that countries' capacity to work together will determine how quickly the region as a whole can overcome the pandemic. Delegates also underscored the need to ensure equitable access to medicines and vaccines for COVID-19 as they become available, giving priority to the most vulnerable populations. The committee voiced strong support for the lines of action recommended in the document on this item and for the actions proposed in the accompanying resolution. The adopted resolution CE 166.R5.
No le contesté, no lo he mirado. ¿Le quieres contestar tú de mi
Recommending
parte
that
o
the
let me do it?
Council adopt the resolution
Dile que
contained
sí, que estoy
in
dispuesta.
document CD 58.
Gracias.
Muchas gracias, señor presidente.
I thank you very much, Mr. Chairman.
Al doctor
Let me give the floor
Barbosa,
to Dr. Jarvis Barbosa, the Deputy Director, and Dr. Ciro Ugarte, who heads the Department on Emergencies, so that they can present the program. A very good morning, Mr. Chairman of the 58th Directing Council. I'm going to share two presentations to this plenary to sum up the situation with regard to the pandemic as we stand, and also to underscore a number of important options. And Dr. Ciro Ugarte will kick off this presentation. Go ahead. Thank you very much, Dr. Barbosa. So let me begin by pointing out, here we go. This is the presentation. You should see it on your screens. Thanks again. This presentation, in fact, was put together towards Friday, but I wanted to share the general lines, the general issues and basic data that we have compiled to give us the status of where we stand with regard to this COVID-19 pandemic in the Americas. Please note this graph, and you can see very clearly what the trend has been from the start. That is, back in February and very early March, really, there were very few cases, particularly in Asia, Southeast Asia, China. And then in Europe, the trend kicked up and it followed in the Americas. And we see proportionally the share of cases in the Americas compared to other regions. We see that Southeast Asia, and here we refer particularly to India, a great uptick then within the global context. And in Eastern Europe, cases started to be noted in April, and by May and June, the trend was fairly stable. With regard to Africa, the numbers started to rise in July, but as you can see, the numbers have remained relatively contained. As to the Western Pacific, very few, a handful of cases, as you can see at the bottom of this graph. But I want to highlight that the number of new cases of COVID-19 and the number of new or recent deaths in the Americas with regard to COVID is a very, very high percentage with regard to the global total. Now, these are WHO statistics, which are constantly updated. And as you can see on the dashboard of WHO, this is the picture at present. Now, with regard to the Americas, the curve you see here shows, of course, the increase in the number of cases, and the blue line that you can see, that thin blue line that you can see superimposed on the graph, gives you the number of cases per week. And so you can see that the number of cases per week has substantially increased, particularly around the 29th of July. That was the high point. Then it started to drop, but in the last few weeks, there has been an uptick. I'd like to say that globally speaking, 6 of the first 8 countries most that have reported new cases, 6 of the 8 reporting new cases are all in the Americas. And an important percentage of deaths are also registered in this region. Here you see a picture. I'm terribly sorry, says Monica. I'm very sorry to interrupt you, but apparently we have lost the French interpretation. Could you give us just a couple of minutes to be very sure that the interpreter working into French at this moment is effectively communicated and connected, and that her language tabs are available? Apparently, we're all good. Thank you. That's good news. And do excuse me, Dr. Ugarte, for that interruption. No problem. And it's always a pleasure to be interrupted if it's going to redound to the benefit of the member states. No problem. And so I was saying, in this particular graph, you see the number of cases per 1 million inhabitants. Here in the Americas, in many of the countries, we have more than 10,000 per mil. This was as at the 24th of September, but I can tell you that today, as I speak, it's pretty similar. This tells us the activity with regard to transmission of COVID-19 in our region is real and active. Here you see the biweekly change in the COVID-19 cases and the deaths in the Americas. Again, at 24th September, you can see, look at the graph on the left, in a couple of areas in the Americas. You see some provinces in Canada, and a couple of states of the United States, a couple of provinces in Argentina, if you look down, and a couple of regions also in Chile, and a couple of departments in the Caribbean, particularly Cuba, and towards Venezuela. Here you see an increase in the number of cases as compared to the weeks before this picture. And on the right, you see the deaths as there has been a change in the last 14 days. That's the trend. And the present graph gives you, in fact, a very similar picture to what you're looking at here, which was looking back 2 weeks. We now take a look at the graph that reflects the territories, countries in the Atlantic and in the Caribbean. Cases that began to be tracked, from 1st of March, then you see how the uptick goes from early June. And as you know, it's the Dominican Republic and Puerto Rico that are the hotspots in the Caribbean, but also French Guiana. And we've also noted a couple of cases in the Caribbean, especially again in the French territories, and a few of the British territories, overseas territories. Now, again, you see the English-speaking Caribbean islands, and the increase in cases that you see there is quite striking as compared with a fairly low rate through mid-July. But then, please take us back. Thank you. Which absolutely tracked the initiation of international flights. And so it is clear from this graph how important it is to follow that issue very carefully. And that is indeed why most countries are clamoring for very specific regulations for a restart of non-essential travel. And indeed, that is the proposed draft resolution or proposed resolution that is being looked at as I speak under COVID-19. Next, for Central America, you see that the number of cases stays high from the second week in July, approximately, things kick off. You see that in Costa Rica and Guatemala and Panama as well, there are a number of cases that are proportionately higher than that of other countries. And the number of cases per week, which again you see in that thin blue line, that's the weekly trend, are relatively high. So those are two important pieces of information. I want to say this. First of all, there is a detection capacity, number one, and two, the management of these cases in terms of treatment has also improved. It's true for Central America, but it is also true of the entire Americas region. Now we turn to the number of cases in South America. And you can see that the number of cases that are reported remains high. Over this period that's pictured in the present graph, just in the last few weeks, you see between 55,000 and 60,000 cases, new cases that have been registered. Brazil, Colombia, Argentina have an increase in cases as well, relatively speaking, over just these last few weeks. Now, let me very quickly turn to some of the main aspects of PAHO's response to COVID-19. Now, when I say PAHO, allow me to speak here of the organization that is the Secretariat plus the member states, because we are responding jointly with regard to the 9 strategic pillars in terms of response, both the organization and the member states. And in every one of these 9 strategic pillars, I want to point out that it's been a very, very deep and broad level of cooperation. And that is what we believe has made it possible to reach some very positive, concrete results in our region. And let me detail that response in a little more detail, giving you a timeline, a very brief timeline of what we've been doing in the Americas. When on the 2nd of January, for the first time, PAHO received a report of a cluster of pneumonia of unknown origin in Wuhan City. There was a risk analysis that was carried out by WHO almost immediately thereafter, and on January 16th, ours was the first region to launch an epidemiological alert when only 2 cases were reported outside of China. Now, that is hugely important. Let me say why. Because in our region, the capacity of our country in terms of detection on the one hand, but also in terms of laboratories and public health emergency responses shows here a very important stride forward. Now, on 17th January, the director of PAHO decided to activate the incident management system regionally. 24 January, as you well know, a letter was sent to all member states sharing key consideration on the 2019 novel coronavirus and its implications for the Americas, accompanied by very specific recommendations in terms of labs and registry and treatment, etc. 28 January, the activation of emergency procedures were also activated, reprogramming funds, the delegation of authority and region-wide incident management. And by the 15th of March, we had already completed 25 technical missions to countries. That's back when we could still travel, you understand. Now, Besides that, we were able to see in the region what needed to be done for a functioning multi-sectoral, multi-partner coordination mechanism for COVID-19. This is what we want to show by way of our country indicators. We also wanted to be sure that there was an in-country capacity or access to international laboratory and a clinical referral system in place to deal with the COVID-19 cases. Now, let me add the following. I want to describe a little bit the change that has occurred in terms of the availability of the public health response, particularly ICU beds, from the baseline to the moment at which this particular report was concluded, towards 31st of July. With regard to 8 countries, I say again, we see here that the number of ICU beds has risen by 29%. And we see that the occupation has been very, very high, 78% is taken. That means that had we not bumped up the number of ICU beds that are available to begin with, very likely a very high percentage of the people that are now currently in intensive care would not have had that care. And what does that say? That shows in part that the number of deaths is lower than would have been the case otherwise, as has been pointed out. Let me also, with regard to emergency treatment, point to the initiative that was launched in the Americas and that is now a global standard. In many of the countries of the Americas, what we saw was an adaptation of the health system, but at the same time, a mobilization of emergency teams to respond to the needs, not only in terms of operational, of deployed individuals and operational. In fact, we launched 82 missions there, but also an adaptation of different places, stadia, hotels, various other environments where such medical attention could be afforded, as well as, of course, to offer isolation and quarantine. But we've still got challenges. Let me touch on these. Among the key challenges we have with regard to surveillance, rapid response teams, and case investigation, we see that still today, the existing national surveillance system has challenges to meet and the need for expanded capacities. And I'm not speaking only of COVID in that regard, but all other issues as well. And you know very well that there are a host of other diseases that require oversight and that are very much part of the national surveillance systems. And we note there that outside of COVID, there's been a drop in reporting on those other diseases. The other issue to note is at the points of entry, a limited ability of the health sector to influence decision-making relating to what are the resuming of essential and non-essential international travel. Now, it becomes very difficult to weigh the economic, social, and political factors that are very heavy in that context vis-a-vis the health sector. And so it's really a challenge to inject in policymaking at the highest level the health component vis-a-vis those others, which we recognize are heavy as well. I move on. With regard to national laboratories, we have a limited test number available to investigate all suspected and probable cases to detect the presence of the SARS-CoV-2 virus. And that is without taking into account patients who travel and asymptomatic cases. And with regard to infection prevention and control, we note that this problem has weighed heavily in our health system and was already there before COVID-19, has of course become ever more challenging, not only with regard to the limited capacity to implement national regulation frameworks, but also the limited human resources available. With regard to case management, ladies and gentlemen, we have optimized services and the delivery of that standard of care for all COVID-19 patients in a rational and sustainable and evidence-based manner. That is the focus. This regards also the actual treatment offered for these cares. But there's a great deal of controversy with regard to such treatment, and a number of countries have taken their own internal decisions in that respect in order to bridge the gap in knowledge. The other point that I need to make under this rubric is operational support and logistics, which is always difficult when borders are closed, travel is shut down because of the lack of sufficient and sustained resources, and the timely procurement and distribution of PPEs, of equipment and diagnostic supplies to priority countries and emergency hotspots. Thanks to the links that PAHO had, many of those requirements were able to be met, but we have to say that a number of countries continue to have difficulties getting what they need. And finally, with regard to maintaining essential health services and systems during the pandemic and beyond, all levels have been affected. We refer here to essential services, whether it's at the primary level, secondary, or tertiary level. And we see this also not only with respect to demand by COVID patients, but also because most or many of the members of the population don't avail themselves of those services, and in some instances are turning to the virtual mode. There are also legal provisions for emergency authorization medicines and other health technologies where there is a lack or a limitation, such that results in a negative impact on the supply chain and development treatment protocols. That has an overall impact on the health services as a whole, which leads me to the point that we must invest more on disaster risk reduction and in safe hospitals, for instance, and in other areas that may be forgotten in some places, but that in our region are very, very real. We're talking about disability inclusion in the hospital disaster risk management and engaging with indigenous peoples, the migrant populations, planning and implementation of emergency preparedness and risk reduction. And so, in this next slide, let me just point to the non-pharmaceutical measures in our region that, of course, pose a number of very difficult measures to implement, these non-pharmaceutical measures, because we understand that there where these have flattened the curve and delayed the peak of the curve, we still have a difficulty given the number of cases that continue to be high. And this generates a false sense of security, which is often why we drop our guard. And most of the population say, oh, really, we don't have to follow these measures. And I see that French has been dropped as well again. But let me go on. The danger is as losing the advantages we have gained because people have this false sense of security. There are tensions then that have arisen in terms of evidence and perception, the myths, the market, and the common sense elements. Public health and its link to the economy, to society, and politics are a very hot issue. And in terms of challenges ahead, there's the question of resuming international non-essential traffic and the adjustment of non-pharmaceutical measures in the short, medium, and long terms. We need specific dates versus conditional dates, and that is a very high bar to meet. Next. Could you move to the next slide? So in this most likely scenario that we will see in the future, what we foresee is the following. We'll likely have recurring waves and outbreaks occurring in different locations in our countries, either within the same country or subregion, or simultaneously, or at different points in time as the economy progressively reopens. And that is why the document that we're analyzing on COVID-19 in the Americas poses 4 key lines of action that, in our judgment, need to be strengthened in terms of 1, leadership, stewardship, and governance; 2, epidemic intelligence, epidemiological input. Three, health systems, service delivery networks, and emergency operations in response to the situation and supply chains. Those are the four main axes that we are putting forward. And with this, I thank you for your attention, and I give the floor to Dr. Jarvis.
Thank you very much, Ciro. I would ask to be given permission to share my screen, and I'm going to be making a presentation having to do with the impact of this pandemic on other public health systems in the region. And then I will be reflecting on COVAX and the importance that this has for all of the countries. Right now, I know a lot of attention is being paid to COVAX. So, country challenges. Countries had to respond not to one crisis, but to three: the public health crisis, the economy crisis, and also a crisis in social conditions. Now, this shows the report that was published by PAHO working with ECLAC, and it shows about the drop of 9% in projected growth of Latin America and the Caribbean. Also, you see that there is a spike in poverty and extreme poverty, moving up to 37.3% of population in Latin America. And in terms of extreme poverty, there is an increase to 15.5. Also, a major drop in exports. Now, that is especially true of countries that are tourism dependent. That would be the countries of the Caribbean, especially, and there they have been affected. Now, this impact can mean that we're losing 10 years of growth in terms of GP. We can see the predictions for Latin America and the Caribbean, and there is a slippage going back to the same level that we were at in 2010. And in terms of poverty levels, also the reversal is 14 years. So a lot of the measures adopted by countries that are actually still being adopted to deal with this have an important role in cutting back this increase in poverty, and this will bring important relief to the population. Also, the countries, in addition to dealing with the pandemic, had to consider how they could maintain services, their priority health, public health services. Here we see some preliminary results of a global survey, and we have 18 countries from our region. It's important to look at services, things like family planning, contraception, prenatal care. Here you can see the reduction during the pandemic and many other services too, including a campaign where there was a report on the part of the countries. 40% of the countries had a problem with continuing to operate. And then here we see treatment and diagnosis of non-communicable diseases. Here too, there were problems with continued operations.
Starting with operations. You can put on the
Here,
video until they call us.
this is part of the same survey, and you can see the different approaches that have been adopted by the countries to try to keep their services up and operating. Here, there are a lot of things that are being implemented in the communities themselves to inform about changes, to talk about different ways of accessing services. But you can see that we still have a lot of room for some solutions that can support lowering these barriers. Here we have the redirecting of patients to alternate facilities, also using triage to identify priorities. And here we have an example of the impact on immunization. And this is comparing the first half of 2019 with this year. And you can see the reduction, 24%, if we take the number of immunizations actually applied. So that means that 1 in 4 children were not vaccinated appropriately during the first half of this year. Now, regarding mental health, here these are surveys in different countries. Here we have United States, Brazil, and Mexico, and others have underscored the fact that half of the adults are reporting that their mental health has been negatively affected. And in terms of healthcare workers, you can see these are people that are on the front lines. And this follows a general model, but they too point to the need for providing psychological support. This is an important part of our response. Here you can see some of the strategies reported by the countries, saying that they adopted them to assure that services, diagnosis, and treatment can continue to function. Here, once again, you can see, and this is for the non-communicable diseases, you can see that 71% of the countries used triaging to identify priorities. So that was a big leap in the region because in the past they were not using telemedicine before the pandemic, and then, or they used them on a very limited basis, and now they are. Also, there is good room for technical cooperation to help the countries so that these measures can overcome this new barrier that affects especially the most vulnerable populations. Here for malaria, let's look at Haiti and also the state of Acre in Brazil. You can see the reduction in the number of cases, but actually there is a very sizable reduction in testing capacity in both cases. So it's not so much a reduction in the number of cases, it is more the possibility of testing and identifying malaria cases. Here we can see some examples of actions taken by the World Health Organization and how we can adapt or how we can be innovative in adapting these strategies so that services can continue to operate. Another important point has to do with inequities. This is an important characteristic of the Americas, and COVID-19 once again points to the need of having specific policies to decrease inequities. These are data from the CDC in the United States. They have very good data for the United States, very detailed information, and it shows the risk. The risk of hospitalization of indigenous populations is 5 times higher than non-indigenous populations. And then if you make a comparison with Afro descendants in the United States, the ratio is 4.7 times higher. Now, here for different countries, this is data that we have on indigenous populations. All of this is just to emphasize that, and close to Brazil's border, as you can see, there is a relative risk that's almost 12 times higher. An indigenous population that lives in this area has that risk that is 12 times greater of developing COVID than the rest of the population. You can see the same for other areas in Brazil and in several other countries too, in Bolivia, in Peru. In other words, these are historic difficulties. Often it's hard for these populations to access healthcare services, so they are at risk, and during the pandemic, even more so. And that is quite visible in the countries that need to make an additional effort to remove these barriers to access. Something else that I would like to point out has to do with the health information systems. This is a tool, and we've been working on this with the Inter-American Development Bank. It is some work that is ongoing in 40 countries or territories in the region. They're using this tool. It's a tool that makes it possible to look at innovation in our countries. Here for innovation, we are well below the level that would be necessary. 6% are at the best level for innovation. The same can be said about knowledge and sharing, the way knowledge is shared. So there are many areas where progress could be made. Now, we do have significant challenges in this area, a lack of interoperability, so as to get access for all of the Ministry of Health, all of the different levels in the country, everyone needing this real-time data. In Latin America, we have another problem, and it is a lack of connectivity. It is estimated that there are 200 million people in the Americas that have no access to internet. Also, often in our countries, we find that we have laws or regulations that are outdated, and they do not provide a situation that is favorable for using the internet or digital information. Also, this stands in the way of good surveillance. Then, regarding gaps, there are gaps in human resources, competencies, and training. Now, in the resolution, we mentioned these 4 lines, and I would like to very quickly cover with you some of the issues that I think are especially important. Strengthening governance of health systems in countries, also the fragmentation of systems, that is a big barrier in terms of optimal epidemic management. Also, it's important to develop capacities to implement essential public health functions, including the preparation, the surveillance, response following the international health regulations. We have to initiate preparatory activities for immunization activities. Now, we hope to have a vaccine within a few months, but for that, we need to do communication, we need to train our health personnel. So there are many different measures that have to be taken as of now, working with the different ministries of health. And then there are some measures that can mitigate the negative impact of populations in the most vulnerable situations. And also, I think that we always have to call for greater equity in dealing with the therapeutics and vaccines to deal with COVID-19. Now, back when we were dealing with H1N1 and that epidemic, the poorer countries in Latin America and the Caribbean only got vaccine access 6 or 8 months after the more developed countries had that available. So this is an important lesson that was learned back then. We have to advocate an equitable process. Also, we need to strengthen the resolution capacity of our first level of care. We need to identify those barriers that are specific in each country, each province, each state, to better protect populations that are in conditions of vulnerability. Also, the infection prevention and control programs. Unfortunately, in Latin America, in most countries, we have seen that many healthcare workers have been infected by COVID-19. Also, we need to strengthen our information systems for health and increase access to digital solutions. We need to leverage and strengthen all use of all advances in treating COVID-19 to progress towards universal access to health. Now, in wrapping up, I wanted to point to lessons learned. We need to guarantee the right to health, the right to access health. That is important in the COVID pandemic. We have to make certain that everyone that needs access has it. Also, we need to strengthen information systems for health, digital transformation. Now, in almost all countries, measures have been implemented, and they're important to provide for social protection of people, especially the most vulnerable and the poorest segments of population. Another important thing during this whole period is, to the extent possible, we have to reduce the dependence of Latin America and the Caribbean on imported products. Early on in the pandemic, these countries had to basically fight to get very straightforward personal protection equipment. Everything was being imported. And at a time of a global crisis, that reliance, that dependency is an important weakness. And then regional integration also is important, as is solidarity. We had excellent examples during the pandemic, and those examples should be reinforced and be part of countries' preparation. Now, to conclude, I wanted to make a few comments on the COVAX facility. And with that, I will conclude my remarks, Mr. President. Now, we have made an unprecedented effort to develop a vaccine against COVID-19. We have more than 191 candidate vaccines. There are 10 vaccines in phase 10. We keep hearing information about this, but there is a lot of uncertainty regarding some important things. What vaccine will be the most effective? What vaccine is going to require more or fewer changes in the cold chain storage available in countries? How long will protection last? When will the vaccine be available? How will it be made available? Will we need one dose or more? So there are a lot of question marks. And often we find that these vaccines have a different technological platform. Here we see a summary of those vaccines in phase 3. Here you can see, for example, that some of them are RNA vaccines. Others use serological techniques that were already known inactivated virus, for example. We have a lot of platforms that are being used. And another important thing is that many countries in Latin America are already participating. They have their centers, they have their regulations in line, and they are participating in these efforts so as to provide the number of volunteers required for testing in phase 3. So here we can see people participating in Brazil and Mexico and Colombia and Peru, Argentina, Chile, and so on and so forth. And I'm sure that more countries will be joining this group. Here you can see the major challenges faced by the COVAX facility. Here I'm going to refer to where we are more or less. Here on the 18th of September, that was the deadline to sign the agreements. We have 18 countries. These are self-financing countries, and they already signed up with Gavi. Other countries are still looking at their legal system within the country to submit their signature. Then on the 29th of September, there is a Gavi board meeting, and they will be deciding on an important issue for the countries. And that is a support to the 10 countries of the region that are going to receive support. Those countries may have to make some sort of payment if Gavi does not manage to get all of the donations that would be required to provide full support to those countries. Then on the 9th of October, that is when the first payment will have to be made, the down payment, the upfront payment to reserve the vaccines. And then we will see the launching of the first procurement process, the tendering process. That is a joint effort, and there we will be working with UNICEF, and these are the two mechanisms of vaccine procurement recognized by COVAX. Now, the countries had to decide how to participate under COVAX, and the countries are acquainted with these two options. And here I wanted to say that those countries that opted for the committed model, there they have a specific clause that has to be included in their agreement so as to have flexibility. For example, if the early vaccines that appear, if this is part of the tendering process, if they come in at a very high price, the country has the right to say, I do not want to receive vaccines under this protocol. This is not within a range that is affordable to me as a country. Now, we are looking at the two procurement mechanisms. Some member states have asked that our director do an assessment, and she authorized PAHO's negotiations with Gavi so that we can reach an agreement between PAHO and Gavi, and that can help the countries of the region, allowing them to send this down payment, this upfront payment that is due by October 9th, so it could be sent through the revolving fund. And in that way, that means that they would not have to send their contribution immediately. Also, we are in discussions with the IDB and with other parties to see how we can support the countries of the region. We are working with UNICEF, devising a coordinated strategy for the procurement, and also within COVAX, we're talking about the principles of the revolving fund, having a price for all developing countries, a price that would be affordable by countries. Also, we are providing technical assistance to countries for them to prepare. As I said, when we talked about the COVID vaccine, there are many different steps that are important. We have surveillance, we have post-market surveillance, we have communication. All of this is essential for a new vaccine. Also, the revolving fund is working because other vaccines have been, or the supply, the manufacture of those vaccines has been disrupted by the pandemic. So the revolving fund is looking for alternatives to assure access to those vaccines. Also, the same applies for associated supplies. Then COVAX expires in 2023, but after that, we will probably continue to work with the vaccine suppliers and member countries to assure that they will continue to have access. That concludes my presentation, Mr. President, and I thank you.
Muchas gracias a los doctores
I want
Cirugarte.
to thank both Doctors Ciro Ugarte and Jarbas Barbosa for their presentations, and now I offer the floor to the meeting for our discussion. We are going to have 2 minutes for member countries and for non-state parties. We would ask the latter to use 1 minute. So we have several requests for the floor. So I would ask that you be as strict as possible in your remarks. Brazil. Brazil has the floor. Brazil, please go ahead. Thank you very much. Thank you very much, Mr. President. I'm going to try to be very brief. I just wanted to make our remarks having to do with COVID-19. Now, we have surveillance and rapid treatment in emergency conditions. In February, we established Centers for Emergency Operation in Public Health to plan, coordinate, and implement emergency measures, especially for COVID-19. Now, we have notified WHO after we confirmed our first case in late February, and we worked closely with different entities in Brazil. And here I wanted to thank the representative of PAHO in this country. She always works closely with us to come up with a joint response. Now, in terms of the pandemic, Brazil has invested $17 billion, of which 12 billion have been for uh, services that were general and another 5 for COVID. We have pulmonary researchers working on this. We have bought 270 million units of PPE. We hired 4,800 medical professionals. We invested $504 million in emergency health supplies. Also, we have advanced in terms of implementing our national network on health, and we are increasing testing capacity in our laboratories. We are investing in improving our surveillance mechanism. Brazil also worked with ACT Accelerator and worked with the WHO director. We were chosen to be part of the Market Shapers Group. That's another initiative. And we were able to be part of the governance mechanism. Also, we have signed on for the COVAX mechanism. All of this with the idea of entering into agreements with the manufacturers of vaccine. We also are working with biologicals and strengthening our domestic manufacturing capacity. And we also have signed for transfer of technology from AstraZeneca. We are coordinating mechanisms with our neighboring countries as part of this pandemic, working with Uruguay in terms of border settlements, also with Colombia in terms of our binational health surveillance mechanism, and with Paraguay to assure transborder trade, in addition to providing supplies for the medical community. We understand that the only way of overcoming this crisis is by strengthening our health sector with resilient resources. We need to guarantee everyone free and equitable access in dealing with COVID-19. Brazil, more than ever, is engaged to jointly overcome this global challenge. We hope to be able to continue to work side by side with our partners in the region of the Americas, always with the support of PAHO. First of all, I wanted to apologize on behalf of the Secretary of the Ministry of Health, who unfortunately was not able to join us. But thank you very much for your attention. Thank you, Brazil. I now recognize Argentina. Argentina, please go ahead. Thank you very much, Mr. President. We would like to reaffirm the commitment of Argentina to in the application of RE so as to maintain joint capacity and assure that this will be part of the national health system. Also, we feel it's important that PAHO play a leading role in dealing with this event. Of course, we have to strengthen the mechanisms that already exist in the countries. We know that the region of the Americas today is the hotspot, the epicenter for COVID-19. But in Argentina, we have a high community incidence. But thanks to our federal intensified strategy, we have been able to control the risk factors. And now we have a mortality rate The rest of the world is 3.4%, but in Argentina, it's 2.7%. Now, with a view to organizing a comprehensive response, Argentina set up a unit of general coordination for events of public health of international concern, working with the cabinet of ministers and within the Ministry of Health. In this way, we took early measures that were health, social, and economic to deal with the impact of the novel coronavirus. After our first case was detected, we entered into social distancing that was made mandatory across the country, and we worked with screening and diagnosis of COVID-19. Work was focused on early detection, isolation, and tracking contacts. Also, we worked to strengthen national production of critical inputs and worked on mechanical respirators and reconverting part of our textile industry to produce personal protection equipment. Also, there were important national developments, a serological test to quantify antibodies, and the use of sera. Argentina, please conclude your remarks. Argentina expressed its interest in supporting all regional and global initiatives that would make it possible to accelerate research and develop a vaccine and increase vaccines that are voluntarily licensed and in keeping with different agreements on solidarity. We have supported a UNICEF initiative and also the call for solidarity in the part of Costa Rica. Now, regarding this, we would ask the Secretariat, or we thank Secretariat, and at the end of paragraph G of an agreement, taking into account the economic situation of the developed, developing, and less developed countries, we support the efforts. Thank you, Argentina. We recognize St. Lucia. So, St. Lucia, please go ahead.
Santa Lucía tiene la
Good
palabra.
morning. Yes, good morning.
Escuchamos.
Thank you.
Hable, por favor.
Mr. President, the government and people of St. Lucia thanks the Director of PAHO, Dr. Carissa Etienne, for her comprehensive and holistic report on the 58th Directing Council. The extensive coverage and content of the report will guide us moving forward with our healthcare plans and strategies in our small island state. We thank PAHO WHO for the support and assistance that has been extended to us in our fight against COVID-19. St. Lucia has recorded a total of 27 confirmed COVID-19 cases to date. Presently, there are no active cases of COVID-19 on island. St. Lucia has recorded 0 COVID-19 deaths. A total of 7,945 tests have been conducted to date. We continue daily testing for COVID-19 at various sites. 5 respiratory clinics remain open to facilitate anyone with respiratory signs and symptoms of concerns. From the onset, we established a 311 hotline to assist and address concerns and questions emanating from our citizens. We activated our state of emergency, divided the country into 2 zones with restrictions for travel between the zones, and instated a 7-day, 24-hour curfew in order to identify, manage, contain, and treat the virus in country. Once we had the virus under control, we gradually reopened our country and our borders on June 4th, 2020, with strict protocols and restrictions. Without the assistance of PAHO, WHO, corporate citizens, friendly foreign counterparts, the government of Taiwan, the government of Cuba, we would not have been successful in containing the virus. Special thanks goes out to the government of Taiwan, who has donated over 100,000 boxes of masks, as well as ventilators.
Muchas gracias, señora ministra.
Thank you very much, Madam Minister. I now offer the floor to St. Kitts and invite Cuba to get ready. St. Kitts, please go ahead.
Thank you very much, Mr. President. Mr. President, in this unprecedented fight against the invisible enemy COVID-19, St. Kitts and Nevis has benefited tremendously from its bilateral and multilateral relationships. I express gratitude to the United Nations, the WHO, and PAHO for their steadfast partnership in making equipment, resources, and technical advice available to our region. Mr. President, I also record our gratitude to the Republic of China, Taiwan, for its strong friendship to the people of St. Kitts and Nevis. The Taiwan model has been the most successful global example in the fight against COVID-19. Taiwan can help, and Taiwan has been helping through technical expertise and the provision of PPEs, testing equipment, medical supplies, ventilators, and much needed masks. Mr. President, I also express gratitude to our great friends, the United States of America, which has provided tremendous support during this difficult period, including furnishing ventilators to the St. Kitts government and the people of St. Kitts and Nevis. Interestingly, those ventilators had critical components manufactured right here in St. Kitts. Mr. President, please allow me to also express profound gratitude to the government and people of the Republic of Cuba. Cuba has been a faithful friend to St. Kitts and Nevis and the wider Caribbean region. In response to the global pandemic and despite its own well-known difficulties, Cuba responded by sending a cohort of specialist doctors and nurses to assist St. Kitts and Nevis in its valiant fight against COVID-19. Mr. President, this great humanitarian gesture by Cuba was replicated by them throughout the entire Caribbean region, parts of Latin America, and even in Europe when Italy faced the height of this crisis. St. Kitts and Nevis thanks Cuba for its tremendous support in this season of great difficulty. The Federation of St. Kitts and Nevis is set to reopen our borders to international travel in October, and we expect to see a surge in the number of COVID-19 cases at that time. In order to reopen our borders effectively, the Federation must demonstrate that it has sufficient health system and public health capacities to do so. The Cuban health personnel is helping in this regard. And so once again, St. Kitts and Nevis wishes to express its profound gratitude to all our partners as we continue to fight this pandemic. Thank you, Mr. President.
Muchas gracias, señora ministra.
Thank you very much, Madam Minister. I now offer the floor to Cuba, to be followed by Haiti. COVID posed a health risk to the country. Its prevention and control has been priority for our government. Since January, we began to prepare, approving a national plan that was cross-sectoral with participation of state ministries and government, social organizations, community entities, directed by the President of the Republic, Miguel Mario Díaz-Canel Bermúdez. Actions begin and end at the community level, actively seeking cases through searches throughout the population, self-searches, specialized surveillance of suspicious cases, isolation of contact, and diagnostic testing. All the conditions were set to provide exclusive patient to symptomatically confirmed patients, as well as the asymptomatic and suspicious. We strengthened the National Laboratory of the Tropical Medicine Institute Pedro Lufuri, as well as a molecular biological lab that covered the entire territory, increasing significantly the number of PCR diagnostic tests. Health staff have worked actively. Our protocol and the use of medicines developed by our biotechnological and pharmaceutical industry have made it possible for 87% of contagious persons to recover. The death index was beneath the regional and international rate. There is a test going on for vaccine against COVID. We'd like to reinforce also our international solidarity by sending 52 medical brigades from the Henry Reed contingent to 39 countries and territories afflicted by the pandemic. All of this despite the impact caused by the economic, financial, and trade blockade imposed by the United States that has become even worse during the pandemic, that affects the arrival of supplies and the care that can be provided and support offered by Cuba. Our country has also received solidarity President interrupts to say time is up. We'd like to thank PAHO in particular. In conclusion, let me reiterate that we have proposed to strengthen the content of the resolution having to do with international cooperation and solidarity. At a time of pandemic, collective, united action by PAHO is absolutely key. Thank you very much. Thank you very much, my Vice Minister. I now recognize Haiti, and Mexico will be following. Thank you, Mr. President of the Directing Council. I greet my colleagues. Haiti would like to express solidarity to the member states of PAHO WHO as we confront what is probably one of the greatest challenges with this crisis, its impact on the social systems and economies of our countries. Mr. President, Haiti has received support and contributions and help from PAHO WHO, which has allowed us to obtain somewhat positive results when it comes to impact on propagation and spread of the pandemic as compared to catastrophic effects elsewhere. PAHO has supported us from the beginning by assisting us in testing and in conducting surveillance, helping us train our staff, providing institutions with equipment and material. While thanking the organization for its support, Haiti urges all the countries in the region to support as far as possible the actions that are so important for our peoples and support received from Cuba that manifested its solidarity, especially by providing human resources to our country and to all others who expressed a need. The government of Haiti has moved funds from the public treasury to tackle the pandemic, in particular to procure material and the equipment that is so necessary to take care of cases while protecting health workers, ensuring also communication and sanitation. Haiti, as of 26 September, has 8,700 confirmed cases and of which over 6,000 were recovered. The response has been absolutely appropriate from the onset of the disease, but at first there were some hesitations because of the weakness of our health system, the lack of PPE, limitation in the number of equipment, material, and equipment to take care of patients. Some innovations are worth mentioning. Medical support and psychological support for our patients through our call center. There is a community strategy to take care of patients at home, a multi-sectoral approach, community participation through the traditional methods. At this point in the crisis, we have learned that it is necessary to continue strengthening the health system, in particular coordination, epidemiological surveillance, and the strategy of providing primary health care while drawing lessons from the crisis and ensure that health is prioritized in all policies. We need to reinforce regional solidarity through PAHO WHO, and we appreciate their leadership during this tragedy. Mr. President, this COVID-19 pandemic has come to underscore for us the need to have resilient health systems based on international solidarity as support for the international health coverage, and I thank you for your attention.
Muchas gracias, señora ministra. Tiene la palabra.
Thank you very much, Minister. I now give the floor to Mexico, to be followed by Canada. In the context of the COVID-19 pandemic, Mexico recognizes in the international health regulations that we have instruments that allow us to respond rapidly in a reliable manner to the events that are jeopardizing health. Therefore, since late 2019, Mexico, through its epidemiological information system, has started monitoring cases after we saw events in Wuhan. In compliance with the regulations, we did not close frontiers. We have interference, I'm afraid, from Haiti. These actions were not able to stop the transmission because of globalization of the disease. To this, we must add that by the time SARS-CoV-2 had extended, it had already become an international contagion, and the epidemiological systems could only identify it when people started to show symptoms. The surveillance and control system has been dynamic in accordance with our policies. For epidemiological surveillance, we have focused on asymptomatic patients, integrating a sentinel component of viral respiratory disease, allowing us thus to know how many people in the population were afflicted by COVID-19. Furthermore, we had a risk contention and mitigation process to stop the spread, so that all suspicious cases, regardless of whether or not a test was used, could be isolated and studied and follow their contacts in order to try and break the transmission chain. To avoid the collapse of the health system, services were reoriented and the hospital response capability was increased twofold, and take care of patients regardless whether or not they had been confirmed as COVID-19. These are people who nonetheless require medical treatment. We have collaborated with the organization's country office. President interrupts to say time is up. So we thank also the work that has been done jointly with PAHO. In order to achieve consensus, Mexico will not submit amendments to the resolution, but in COP2, we call upon the organization to not focus its actions for a single disease, because we think that the COVID-19 pandemic has shown us that a vision of broad respiratory viruses will give us a better opportunity to respond to these global threats. Thank you very much. Thank you. Canada is now recognized, to be followed by Honduras. Thank you, President. Let me begin by saying that Canada supports the role that PAHO is playing in the regional response to challenges and emergencies, including COVID-19 pandemic. We believe that the continuity of PAHO operations are fundamental, especially at this time that is so critical.
We have been pleased to assist PAHO with its response to the pandemic, having provided $9 million in humanitarian assistance and in response to bilateral requests for support in the region. PAHO is one of our most reliable partners, notably through its delivery of gender-related results in health programming, which is a critical part of Canada's feminist international assistance policy, and in supporting the region in reducing health inequities. We also appreciate the organization's leadership in providing technical guidelines on many issues related to the pandemic response, and we encourage PAHO to ensure that present and future direction reflects the World Health Assembly Resolution 65.8 call for member states to monitor progress in reducing health inequities. We agree with the actions proposed in the document to improve the situation, including the importance of an intersectoral approach to the response. In Canada, for example, we have undertaken a whole-of-government approach to addressing the pandemic. This has included both public health and socio-economic measures and engaging authorities at the highest levels. We believe it is essential and necessary to incorporate a strong gender analysis in PAHO's COVID-19 response, given the differential impact on women. COVID-19 has led to significant concerns about the impact of lockdowns on women and girls, including increased sexual and gender-based violence, an expected rise in the adolescent fertility rate, and increased vulnerability for pregnant women. Additionally, there is also a high proportion of women in the healthcare force and as caregivers, and the pandemic poses additional economic and health impacts on them. Furthermore, Canada would like to invite PAHO to incorporate a greater analysis in PAHO's COVID-19 response on how to address the needs of impacted vulnerable youth and young people.
El tiempo se ha terminado, Canadá.
We value the unique youth perspective and thank the youth delegate in Canada's delegation to the 58th Directing Council for raising this important issue. Lastly, we continue to support the sharing of timely, accurate, and sufficiently detailed public health information related to the COVID-19 pandemic from member states to PAHO and the WHO and between member states in accordance with the IHRs. Thank you very much, Mr. President.
Muchas gracias, Canadá.
Thank you very much, Canada. I now recognize Honduras, to be followed by Jamaica. Thank you, President. Honduras agrees and supports the resolution as set forth in the document and the proposed resolution CER 65/2020. I would like to talk about the financial and technical support and welcome it and thank it from PAHO WHO, especially the permanent leading and technical team in Honduras. Thanks to these efforts, we have managed to save lives, strengthen laboratory work, expand diagnostic capacity in timely fashion, and traceability of COVID-19 cases. Furthermore, we acknowledge that the national information system has been strengthened in real time, allowing for epidemiological analysis on a daily basis and timely intervention. It is important to recognize the support received for essential consumables and mobilization of resources. We need to continue receiving this support from PAHO WHO to maintain the supply chain for essential consumables to address the pandemic, such as those for laboratory diagnosis, procurement of PPE, because there is a global shortage, technical assistance to continue strengthening the information systems in health systems in order to address this unprecedented emergency. I would not like to finalize my intervention, Mr. President, without enormously thanking WHO PAHO for the interagency efforts carried out to establish the app and COVAX in order to speed up investigation and production of accessible medical input, and especially a safe vaccine that will be accessible and distributed on an equitable basis in a timely fashion without having an economic impact on countries. I thank all governments who have contributed and helped Honduras to fight the pandemic caused by COVID-19. Thank you, President. Thank you, Madam Minister. I now give the floor to Jamaica, to be followed by Colombia.
Good morning, Mr. President and members. Jamaica wishes to commend the Director and the Bureau for the work done on preparing the report on COVID-19 pandemic. By way of this resolution, member states are being invited to recommit to working together in all areas of the pandemic response. Jamaica and the other 53 countries and territories in the region of the Americas have reported COVID-19 cases and deaths. Jamaica is currently experiencing community transmission 177 days after the identification of the first case. Jamaica's measures to control the outbreak was based on a COVID-19 response plan that was a modification of the pandemic influenza plan. It included the activation of a whole of government response through the disaster response machinery that sought to balance health and economic priorities. Implementation of the plan required significant resource reallocation, external support, and innovative strategies to allow for sustained health service delivery, including essential health services. Whilst there has been some success that allowed for a delay of the start of the outbreak in country, with concurrent strengthening of the health system, it required significant human resource investment. Sustainability is therefore a critical concern. This is especially so in light of recent change in transmission scenario that will further add to the stress on the system. Jamaica endorses the proposed resolution. However, Jamaica will require technical support in item E, review of the response, and interventions for targets set in the COVID-19 recovery program. We thank you.
Muchas gracias, señora ministra.
Thank you very much, Madam Minister. I now recognize Colombia and would like to recall that interventions must be limited to the agenda item we're currently discussing. Colombia, you have the floor. Thank you, Mr. President. We are grateful for the policy document presented, plus the technical support provided to address the emergency through the PAHO country office under Gina Tambini's. We'd like to thank Dr. Gina and her team for all the support extended to us. We are satisfied with seeing in the policy document the main axes and the strategies put forward by Colombia being reflected. In Colombia, we have gone from obligatory preventive isolation to individual responsible quarantine. We want to reduce the social impact and mitigate economic impacts. We are implementing a new strategy for tracing, and we hope to allow us to have selective isolation of population. We want to locate the virus, not close the economy, not close all of our cities. We want to increase the capacity for detection, testing, and expanded tracing. The scaling down of isolation measures is today a phenomenon common throughout the Americas. And in this context, it is crucial to receive technical assistance from PAHO to strengthen the surveillance capacity, effective implementation of the international health regulations, and support from sanitary authorities so countries may gradually and positively move forward in this new phase of the pandemic. As the report points out, vaccination strategies play a key role to care for the pandemic, so it is essential to receive PAHO technical support, not only to develop immunization plans, but also to strengthen the cold chain and the information registration coverage of vaccination reports. We are conscious of the PAHO revolving fund for the procurement of vaccines by countries under the COVAX mechanism. For this reason, we call upon the Pan American Organization to ensure effective, timely access to vaccines that are effective and safe at the lowest possible price, and to continue helping countries in their process to participate in the COVAX mechanism, providing information and attending meetings to speed up the processes, allowing for informed decision-making. Lastly, we appreciate the measures spelled out in the document, but we think it is important to also include strategies in the document to technically support countries for reactivation of international flights, given the current panorama in the region. For this reason, we have sent in writing a proposal for inclusion in the proposed resolution to focus on this point, and we hope that the Directing Council will support the language proposed. Thank you, Mr. President. Thank you very much, Colombia. I now give the floor to Suriname, to be followed by Uruguay.
Thank you, Mr. President. Suriname would like to take this opportunity to express our appreciation of the support of PAHO and WH has provided in scaling up the response to COVID-19. Since the new government came into office on the 17th of July, we have immediately intensified our communication with PAHO, resulting in a significant upscaling of PAHO's assistance in the procurement of necessary PPE equipment supplies, including the rapid antigen test, the arrival of which we are awaiting. By mid-August, Suriname was faced with a huge surge in the number of COVID-19 cases, putting our existing fragile healthcare system under enormous strain. But with the support of especially the Dutch government, who had assisted us for months with human resources, IC nurses, doctors, microbiologists, and laboratory supplies and equipment, we have been able to sustain the heavy pressure COVID has put upon our health system. Our all-in government approach to put in place the necessary measures to contain the spread of the virus has resulted in a rapid decline of the incidence over the past 3 weeks. Currently, the incidence is around 2.2 per 100,000 population. Some of the measures are or were curfew, weekend lockdowns, mandatory mask wearing in crowds and indoor public spaces, closure of bars, indoor restaurants, clubs, dancing, prohibition of parties, mandatory COVID prevention protocols for the transport sectors, offices, restaurants, terraces, supermarkets, casinos, recreational facilities, schools, churches, funerals, certain sports have been put into place. We have scaled up behavioral change, communication, and even have for 2 months daily COVID news aired on the TV stations. COVID transmission currently is low in our country, but the virus is all but gone. We need to remain vigilant and apply stricter measures as soon as we pass an established threshold of cases in order to prevent at all costs a second wave. We thank the local PAHO office for its continued support of our BBC activity, including the rural areas, support to our surveillance and I team, support in our effort to streamline donor coordination and procurement. The challenge we now face is the maintenance of the regular non-COVID health services. As in the other countries, regular non-COVID health services to risk groups such as diabetes,
Suriname, el
hypertension, and
tiempo
other
se ha
patients have
terminado.
suffered due to all the efforts and attention that went to
I'm sorry, Suriname, your time is up.
Thank you, Mr. President.
I thank you, Suriname.
Yes,
Uruguay has the floor with the United Kingdom next up. Uruguay, please, go ahead.
Buen día.
Good morning. Go ahead, you better use your 2
En
minutes,
primer
Uruguay.
lugar, le
Thank you.
agradecemos a Carissa Etienne y a todos
Let
los
me begin by
participantes en
thanking
esta
Carissa Etienne
conferencia.
and all of the participants in this conference.
Hemos atravesado 7 meses de
We
pandemia
have
con un
gone
relativo
through
buen
7 months of
resultado.
the
En
pandemic
este
with a
momento
relatively
tenemos
positive
solamente
result. At the moment,
208
we have
pacientes
208
activos
active
y
patients,
hemos diagnosticado solamente
and we have
2.010 casos en
only
total,
diagnosed
habiendo hecho más de
2,010 cases in
230.000
total,
tests, lo que
with
indica
more than
una positividad de
230,000 tests, which give
0,9%
us a
de positivos sobre el test
0.9%
realizado.
probability in
Hemos
terms of.
tenido una cantidad de fallecidos
Minister,
por debajo de 47
we
personas
have
y con una
fewer
letalidad
than
que estuvo
47
desde el
deaths
inicio de la
with
pandemia en
lethality, which we
2,43%
noted
y
from
en
the
el
beginning of around
último mes
3%.
está en
And in the
torno
last
al
month,
1%,
the
mientras
figure
que la
is about
letalidad
1%, but
está en
mortality is
1,30%
at
cada 100.000 habitantes.
1.3%
Logrado
per
mantener
mil
el vínculo
in order to
del hilo epidemiológico, es decir,
keep
el nexo.
the
En el
nexus with the
66%
epidemiological
ha
story. We
sido
have
por
it at
contacto, el
66%
diagnóstico, y el
through
19%
contact,
por
that's the
viajes,
diagnosis, and
mientras que el
70% through
15%
travel.
no hay
15%
noción de contacto.
has not had any contact. I'm sorry to interrupt you, Minister. You are not being interpreted, says Monica. I would ask you for your assistance in allowing us to try the trick, as it were, that we've had before. In your bar tool at the bottom of the bar tool that you have, if you have to get to where it says interpretation, and you have to mute the original audio. Mute the original audio. That's on your lower bar with the various tools. Thank you. So might we now continue? I'm hoping for a message from my technical support colleagues to be sure that we have the quality of the English interpretation coming through. It was apparently interrupted. The interpreter did not see that. And so I would like my technical support team to assure me that English interpretation is coming through. please, on Uruguay's part, you have to mute the original audio. I think we're now ready, and I would just like the green light from my technical support friends. If the English interpretation can be heard, the interpreter hopes that is the case. And if it is, we will yet again give the floor to the minister from Uruguay for him to begin his statement. Yet again, I'm going to keep talking simply to facilitate the testing of the system. Mr. Minister, could you please speak so that we can test? Yes,
Cómo no, buenos
of
días.
course,
En
and
primer
a
término,
good day. Let me
agradezco al
begin
presidente del Consejo, a la
by
directora
thanking
Carice
the
Etienne y a todos los
chairman
delegados de
of
los
the
países
directing
presentes.
council and Dr. Carice
En
Etienne and
Uruguay, en
all
el
of
momento
the
actual,
delegates here present.
hemos realizado
We here in
y
Uruguay
desarrollado un test nacional de
have
PCR en tiempo
developed
real de biología molecular.
national test,
Hemos
PCR at the
realizado
molecular level. We
230.000
have
test,
carried out
de los cuales
230,000 tests,
hemos presentado
of
2010
which
casos en total
2010
positivos, lo que hace un
cases have shown
0,9%
positive. That's a
de positivos
0.9% case
sobre
of
test
positive
realizados.
results on
Mantenemos
the
en el
tests
día de
that have
hoy
been carried out. And to
208
date,
casos
we have
activos y tan
208
solo
active cases
47
and
personas han
only
fallecido.
48
El
deaths,
66%
47 deaths.
tenemos noción de contacto,
66%
el
have
19% es
yielded
por viajes
tracking,
y el 15%
60% through
no tenemos
travel,
noción de
and
contacto.
for
9 de cada
15%,
10
we don't have the
personas
necessary contacts.
han
9
recibido
of
un
10
tratamiento
people have received
ambulatorio, mientras que
ambulatory
1 de cada
treatment,
10 ha
while 1 in 10
requerido internación en cuidados
has
moderados.
necessitated moderate care
3 de cada
intervention.
100 personas han necesitado atención,
103
cuidados intensivos,
persons have
y el
needed
ingreso hospitalario
intensive
aumenta con la
care,
edad,
and this
siendo
increases with
3 de cada 10
age.
mayores de 65
3
años.
of 10 of
Solo
these
hemos tenido
are
9
over 65
mujeres
years of
embarazadas
age.
que
We've
han
only
sufrido
had
la
9
enfermedad,
pregnant
con un
women who have
binomio
suffered from
madre-hijo
COVID
que han salido
with
indemnes.
a
La
binomial that
letalidad
gives us
se
no
acerca desde
transmission
el
from
inicio
mother
de la
to child.
pandemia a un 2,43%,
Mortality
mientras que
starts with
en el último mes
2.43%,
la
and in the
letalidad
last
está en
month,
un 1%, y
mortality
ello
is now at
explicado
around
porque está
1%.
afectando a personas de menor edad fundamentalmente.
And
Mientras
these
que la
are
mortalidad
reflective
se
of
mantiene
younger
en
people, while
1,30
the
cada
death rate is
100.000
about
habitantes.
130 per mil.
Fundamentalmente, las fortalezas del Uruguay han
Basically, we
residido
feel Uruguay's
en la gran
strength
capacidad de testeo,
rests in
en el
our great
seguimiento
capacity for carrying
epidemiológico
out
caso a caso,
tests,
que al inicio
on
eran
the
4 a 5
epidemiological
casos, luego
follow-up
cuando se fueron
of
abriendo las
tests,
diferentes
4 to
actividades
5
estábamos en 10
cases, and
casos,
then we
y
ended up with
actualmente
10
estamos en
cases.
15 casos
Now we're
por
up
cada
to
positivo
15
contactado.
for
Tenemos
every
todas las
positive
actividades
case
del
that we
país
have
abiertas
contacted.
prácticamente en
All
su
of our
totalidad,
activities are
exceptuando las fiestas de
restored
más de 60
practically,
personas.
except
Y
for
bueno,
parties or
creemos
gatherings
que ha
over
sido
60
en
people.
parte basado en las
We
fortalezas que
believe
tiene el
that
país
the strength that
en su
Uruguay
desarrollo
has
tecnológico,
shown in terms
en
of
sus
its
medios de comunicación
technological
y
development, in terms of
el buen
its
desarrollo de su primer nivel
communication
de atención.
strategy,
Muchas
and
gracias.
a good level of communication in general. Thank you very much. Minister, thank you very much for that presentation, says the chairman, and for your use of time. I now offer the floor to the United Kingdom, with Venezuela next. United Kingdom, you have the floor.
Thank you, Chair. COVID-19 pandemic in the region of the Americas and the presentation given by the Secretariat. PAHO, WHO, and the wider UN system have a hugely important.
You, United Kingdom, you're not coming through.
Can you hear me now? Can you hear me now?
Yes.
Yes. Okay. Sorry about that. We welcome the report on the COVID-19 pandemic in the region of the Americas and the presentations given by the Secretariat. PAHO, WHO, and the wider UN system have a hugely important role to play in leading the global response, and we support their work as well as ongoing processes to strengthen the global response for the future. The response in this region highlights a number of issues that have been crucial globally: the importance of testing, the need for an intersectoral approach, the centrality of broader health system strengthening, and the opportunities afforded by digital systems to both support response itself and provide socially distanced health services. The UK has benefited greatly from exchange with other countries on all of these issues and remains keen to do so, as well as to think about how we can develop systematic but agile ways of ensuring the hugely increased international policy collaboration resulting from this pandemic can remain as a positive legacy of a very challenging period. The report also highlights the difficult trade-offs that have had to be made as part of the response between the economic, societal, humanitarian and public health impacts of various measures we have applied. While there is no simple answer, we must do what we can to maintain essential services alongside response efforts and minimise damage to broader health outcomes, as clearly set out in the second presentation we've had in this session. Finally, we welcome the close consideration given to work around vaccine therapeutics and diagnostics, both in terms of research and development and ensuring equitable access. This will be crucial to overcoming this pandemic, and is why our Prime Minister announced a contribution of up to £571 million for COVAX in his speech to the UN General Assembly last weekend, alongside our existing support to Gavi and Sept. Thank you, Chair.
Muchas gracias.
I thank you, United Kingdom. I now offer the floor to Venezuela. Let me remind you that every statement must strictly adhere to the matter under discussion. Thank you. And Bahamas is next up, the chair adds. Thank you very much. I want to very much hail the work that Dr. Carissa Etienne and Dr. Pedro have carried out. We in Venezuela have seen a slow but steady increase in cases through September, when we started finally to have an impact on the curve. We have 2 to 4 cases per 1,000 and a death of per mil. In June, we observed an increase in the number of Venezuelan citizens who had migrated to neighboring countries and that have come back to Venezuela in the search for safety and health institutions. A couple of 100,000 have been attended to at our borders. 1 in 10 Venezuelans who have come home have in fact been carriers of the virus. About 40,000 Venezuelans have come through the very long land border that we have with Colombia and Brazil. And therefore, the virus has been transmitted in a number of sectors through that means. The presidential committee headed up by President Maduro himself has followed our program. There was an early stage of preparation and training, a second stage for radical quarantining, and that's when our health emergency was launched. We took immediate steps, a third stage of controlled flexibility through the 7x7, 7 days of radical quarantine following 7 of a less radical situation. We have a balance between a gradual reopening of our economic and family life or social life and control of the pandemic. We want to speak resolutely against the sanctions of the United States that have been Minister, you need to wrap up. Your time is up, Mr. Minister. More than $30 million have been sequestered that belong to the Venezuelan people. We can't even take money from that to honor our obligations through the Strategic Fund and WHO. We thank WHO, PAHO for the solidarity expressed, our good friends from China, Russia, Iran, and China. Mr. Minister, I insist, says the chair, your time is up. I thank the Cuban Brigade for the solidarity to our people. I also thank help for the universal help that is offered us to work against COVID-19 and all of the Venezuelan citizens that are helping. We thank Cuba Mexico and Colombia's support to the resolution. Thank you. Thank you, Minister. The Bahamas is next and Ecuador after that. Bahamas, please. You have the floor.
Mr. President, the Bahamas commends PAHO's unequivocal leadership in these unprecedented times. PAHO has been a trusted resource which has served member states well in navigating the ever-changing landscape of COVID-19. Emergencies and natural disasters like hurricanes have led to strengthened national preparedness and response. We could not have fathomed, though, what COVID-19 had in store, much less the sustained assault. Our COVID-19 policies have had to be fluid and tailored to our resources. Admittedly, the prolonged nature of this pandemic has exposed weaknesses in health system capacities, including surge capacity. We look to PAHO for additional tools to assess surge capacity requirements. Human resources remain a challenge for sustaining the COVID-19 response. Health workers are testing positive for COVID-19 and are vulnerable to high-risk exposures. Both have the same result: removal from work environments with severe challenges for service delivery, negatively impacted morales, and increasing burnout. This mandates attention be refocused on prioritizing HRH legislation and other frameworks. Our accomplishments in contact tracing includes the incorporation of digital platforms for data collection, the local adaptation of contact tracing. The Johns Hopkins contact tracing online course is a second accomplishment. This has increased the pool of contact tracers available during COVID-19 and for other outbreaks. The Bahamas would be happy to share this resource with member states. Mr. President, COVID-19 brings opportunities to work with private sector and civil society while building community trust. These opportunities can be leveraged to accelerate and expand on other public health threats, such as NCDs. COVID-19 also reminds us, however, that we still have work to do in discrediting myths feeding vaccine refusal. The Bahamas supports the draft resolution and requests the director to remain steadfast in leadership and to develop indicators for safely resuming non-essential international travel. This is particularly important to the Bahamas and others with tourism-dependent economies. I thank you.
Muchas gracias. Tiene la palabra Ecuador y se prepara Estados Unidos. Adelante.
Thank you very much, Mr. Chairman. Greetings to all. There is no question that the COVID-19 pandemic has been an enormous challenge for us all. In our own particular case, it was mammoth because we have already been undergoing a very severe public health crisis, and to that, we had this additional difficulty, very dynamic and with very deep results, I should say. The scarce resources that we have available have nonetheless served us to strengthen and broaden our capacity to try to increase permanent community vigilance and strengthen capacity and response from the hospitals for moderate and severe cases. This has represented an enormous effort for the country. We have doubled our response capacity at the hospital level, and we have also intensified our results in the case of early diagnosis of COVID in order to carry out the necessary tracing and do our best at that community level. We support the resolution that is before us, and particularly its emphasis on legal issues and the development of technologies that we believe will put us in a better position to respond to the future challenges that will no doubt come. I think all of us in this learning curve that we're engaged in needs to do. We need to act with solidarity. We need to develop a common vision and understand that health is at the core of everything else we do, and certainly of our economy and the very lives of our people. Thank you. Thank you, Vice Minister. I now give the floor to the United States. The United States, please. And Paraguay after the US.
Thank you, Mr. President. The United States thanks PAHO for its critical work to combat COVID-19 in the region. I want to take a moment to offer our heartfelt condolences to everyone who's lost a loved one during this pandemic and recognize the tireless efforts of our frontline health workers. Together as a region, we will continue to fight this virus and improve the health of our people and our economies. The United States is a committed partner in these efforts. We're working tirelessly to develop safe and effective countermeasures for COVID-19. As Secretary Azar noted yesterday, we expect to be able to offer surplus to our partners and friends in the Americas. We support the proposed resolution, especially its request for member states to comply with the IHR and for PAHO to exert transparency, independence, and impartiality when calling upon states parties to share timely and responsible, truthful information. We will look forward to our discussion at noon or during the lunch break on the amendments and have a good discussion there, and thank Canada for its leadership. We reiterate our support for PAHO and look forward to continued open and transparent cooperation with all ministries in the hemisphere. And I would just note that we have asked for a right of reply, and we are awaiting that ability to reply to the unfortunate statements of both Cuba and Venezuela. Thank you.
Gracias por su intervención.
I thank you for your statement, United States. And I would now give you your right to reply. You have 1 minute, US. Go ahead, US, please.
Thank you very much, Mr. President. We regret that we again have to respond to both Cuba's and Venezuela's politicizing the directing council of PAHO. It is unfortunate that the Cuban government is taking advantage of the global COVID-19 pandemic to make completely false claims that the US embargo prevents humanitarian goods from reaching Cuba. For decades, the United States has permitted the sale and donation of agricultural products, medicine, medical equipment, and other humanitarian supplies. Under this administration, all applications for licenses to send medical goods to Cuba have been approved. The United States regularly authorizes the export of agricultural products, medicine, and medical equipment, and humanitarian goods to Cuba. And since 1992, has authorized the export of billions of dollars of those goods to Cuba. In 2019 alone, the United States exported 3.7 million of medicines and medical supplies to Cuba to support the Cuban people, including diagnostic equipment and supplies. That amount represents a fraction of the hundreds of millions of dollars of medical goods the United States authorized for export to Cuba in 2019. In regards to Venezuela, the United States maintains several humanitarian-related exemptions and authorizations under our Venezuela sanctions program to facilitate continued humanitarian support. Our sanctions to promote accountability for the illegitimate Maduro regime should not be an obstacle to providing humanitarian aid to Venezuela. As of May, the United States had contributed more than $856 million to the Venezuela regional crisis response. Thank you, Mr. President.
Muchas gracias, Estados Unidos.
Thank you, US.
It was good and on the fly. I just put as of May. So that's okay. We're good.
The US can be heard. We can't hear the chairman. Let me thank the countries that have intervened, and let me simply say that we are certainly not going to offer a right to reply to the reply. So we will now concentrate on the item under discussion, And I give the floor to Paraguay, with Nicaragua after Paraguay. Thank you, Chairman. Can I be heard? They cannot be very well heard, too far from the mic. The interpreter regrets the delegate is very far from the mic and there's an echo. The pandemic has affected the countries differently and in different ways. This, of course, has made inroads into our economy and our health. It's affected the country differently depending on the regions. We would like to add an issue under the resolution where it moves to the results part with regard to strengthening the focus on health at the borders. There are a number of priorities that should be considered first, the major cities on the borders. We would like to know more about the COVAX advances or progress. For all of these reasons, Paraguay supports the draft resolution or the proposed resolution. Thank you very much. Nicaragua has the floor. And with Nicaragua's statement, we will now end this particular round of statements of countries. We will have a 5-minute break to move to the non-state organizations among us. Nicaragua, thank you very much. And greetings to you and to all on this very important meeting. Nicaragua has developed very key elements in its response to COVID-19. We have strengthened our infrastructure in the health sector, our human rights, our personnel approach, and have taken the measures that have been recommended by WHO and PAHO. We are focused on our health model and try to emphasize the model that puts the family and community first, as well as certain institutions. We allow for some visits home to home, but with great care under the quarantine system. And we value the proposed resolution that has been put for us, understanding that we need to move with a spirit of solidarity in order to face this situation as daunting as COVID-19 is. We thank and support Cuba's positions on the matter. Thank you, Nicaragua. We will now take a 5-minute break, and let us be very careful in clocking that. And following that, we will listen to the non-state representatives among us.
Bueno, muy bien. Reiniciamos nuestra sesión.
Very well. Let us continue with the session. I had requests for the floor from Cuba and Brazil before the break. So let us give 1 minute to each country on the understanding that these interventions have to focus strictly on the agenda, and we call on countries to kindly focus strictly on the issue on the table right now so that we can move forward on this very serious topic, which is the COVID-19 pandemic. Cuba, you have 1 minute for your intervention. Please go ahead. Good afternoon, President. The government of the United States is making false statements again, trying to hide the serious damage suffered by health in Cuba because of the irrational prosecution of these trade issues. They are trying to present requests for licenses received to send to Cuba donations from non-governmental entities and private groups as aid facilitated by the United States. Many of these requests don't even reach Cuba because of the very worst system of coercive, unilateral, illegal measures existing in the world against any country. High officials of the United States government have not hidden when condemning and putting pressure on the countries receiving this aid. We don't even want to mention what happened with the vessel bringing aid. The president is interrupting. We reject the lies said by the representative of the United States. Brazil is now recognized. Please go ahead, Brazil. Thank you, President. I think there must have been a mistake. Brazil has not requested the floor. I apologize, says the President. The President cannot be heard. He is speaking but cannot be heard. Now, yes. There being no further requests for the floor. No, I think Barbados is perhaps requesting the floor. Could you please confirm, Barbados, are you requesting the floor? Barbados, you have the floor.
Mr. President, Barbados has set out on a journey to strengthen its health system in the face of and in response to the relentless COVID-19 pandemic. Within a few short weeks of the first cases being reported in China, we stood up an emergency operations center to guide the implementation of a package of strategies in an effort to prevent, detect, suppress, and contain the transmission of COVID-19 in Barbados. Key highlights of our response illustrating strategic strengthening of the infrastructure of the healthcare system included the procuring of urgently needed medical equipment, from ventilators to laboratory equipment and other supplies in an environment of global scarcity, building laboratory capacity for the diagnosis of COVID-19 through reassigning laboratory personnel and procurement of commodities with the assistance of various entities, including the Pan American Health Organization. The government of Barbados also augmented quarantine capacity, especially in light of the reopening of our borders. We did this by collaborating with our tourism sector and partnering with select hotels, which are quarantine options for travelers into Barbados. Establishment of a standalone isolation facility, Harrison's Point, with the intention of keeping COVID-19 out of the lone public hospital in Barbados. The facility has significantly increased isolation capacity in the country and can manage a gamut of clinical presentations due to COVID-19. The isolation center is managed by a team of healthcare professionals with expertise in infectious diseases, pulmonary, and intensive care medicine. This team has been supplemented by a cadre of specialist nurses from Cuba. Additional human resources strengthening included the acquisition of nurses from Ghana and the establishment of community health liaison officers dispersed throughout the country to assist with health promotion, contact tracing, and other COVID-19 prevention and control measures. We remain exceptionally appreciative to the Pan American Health Organization and the World Health Organization, and also to the Caribbean Public Health Agency, CARPHA, for the unwavering assistance and stewardship to Barbados and our partner countries in the Americas as we aim to improve the health and quality of lives of all of our people in Barbados. I thank you, Mr. President.
Muchas gracias, Barbados.
Thank you very much, Barbados. Nicaragua is asking for the floor a second time. Nicaragua has 1 minute. Please go ahead, sir. I do apologize, but we had not requested the floor. Thank you. Thank you, says the president. There being no further requests for the floor by countries, we will now give the floor to non-state entities. They will each have 1 minute, and we will be very strict with this time. So let us move forward. Let me begin offering the floor to the International Association of Hospices and Palliative Care. Please go ahead, International Association for Hospice and Palliative Care. If they are not available, we will move to the Coalition of Healthy Caribbean. Good morning. And I do apologize, but we had a connection issue. The International Association for Hospice and Palliative Care is grateful to the Council for allowing us to take the floor. I am Patricia Bonilla. I'm a teacher in palliative care at the School of Medicine of the private technical University of Ecuador. I work also with patients requiring palliative care. Palliative care is active, holistic assistance of people of any age suffering from a serious disease affecting their health due to a severe and acute illness, especially those who are close to the end of life. The objective is to improve the quality of life of patients, their family, and their caregivers. We welcome the proposed resolution, especially the budget having to do with inclusion of palliative care in Result 5. We also welcome adoption of resolution by the World Health Assembly in May 2020 and the commitment including palliative care. The members throughout the region are available to cooperate with the governments of member states in implementation of PAHO provisions and resolution of the World Health Association. We welcome also, President says your time is up. We also thank agencies that help control drugs by the United Nations, reminding governments that they need to guarantee that all people in the world should access to essential medicine, including those that are internationally controlled. With good relations, PAHO, this agency collaborated with WHO in the management for clinical care of COVID-19. We urge that the guidelines be implemented. Your time is up, says the President. And strategies for containing and managing COVID and integration of palliative care. Thank you very much. We now give the floor to the Healthy Caribbean Coalition. Once again, let me remind you, you have 1 minute for your presentation. Go ahead, please.
Mr. President, I bring greetings and express thanks for the opportunity to provide an exposition on the Healthy Caribbean Coalition-led NCD civil society response in CARICOM member states to the COVID-19 pandemic. a pandemic which has had a significantly adverse impact on people living with NCDs. Recognizing the need for a multi-sectoral response, the Healthy Caribbean Coalition and its member organizations during the pandemic advocated through an open letter to CARICOM heads of state and government, launched a major advocacy and communication strategy, and it initiated work on a new transformative NCD agenda to build back better. At the national level, Healthy Caribbean Coalition member organizations, in response to the pandemic, mobilized and took action to fill important service gaps for people living with NCDs. Lastly, during the pandemic, despite the tremendous opposition from the private business sector, the Healthy Caribbean Coalition, recognizing the need for public health to take precedence over narrow business interests, has continued to contribute to regional efforts to improve
Your time is up.
of labeling of packaged foods and beverages and to healthy school policies. In closing, the Healthy Caribbean Coalition acknowledges PAHO's strong regional support and leadership in the response to the health and economic challenges posed by the coronavirus. I thank you.
Gracias. Tiene la palabra.
Thank you.
Y
Cochrane has the floor, and the International Nursing Association will follow. Cochrane, please go ahead.
Thank you, Mr. President, and good day to everyone. COVID-19 has emphasized the critical importance of evidence-informed global health policy. Cochrane is a global leader in producing high-quality synthesized evidence to inform health decisions, and we are working closely with WHO and PAHO by producing rapid reviews and living systematic reviews to answer priority questions. Cochrane's geographic groups, in particular in the PAHO region, are also active in supporting an evidence-informed response. Cochrane Canada, with the WHO Collaborating Center for Infectious Diseases Research Methods and Recommendations, have not only led WHO commissioned reviews, but are developing a living map of recommendations from high-quality guidelines for which member states can use to contextualize for decisions. The Cochrane Ibero-America Network has produced Evidencias, COVID-19 information resource, and also Diana Salud, a database containing guidance on implementation and de-implementation of healthcare interventions. The Cochrane US network has also developed a repository and are responding with various rapid reviews and evidence to support guidelines. With the pandemic evolving, the questions that policymakers need to address change. We therefore call on PAHO member states to support evidence-informed decision-making by taking action to provide adequate resources and funding for evidence synthesis given challenges. Thank you.
Muchas gracias.
Thank you very much. The National Nursing Council is now recognized to be followed by the International Federation of Medical Students. Nursing, please go ahead.
Consejo Internacional de
International Nursing Council, you have the floor.
Damos la palabra entonces a la
Then we move to the International Federation of Medical Students Federations. Please go ahead.
Thank you, President. Our region has been forced unexpectedly to transform all previous health systems and administrations so as to adapt rapidly, attempting a response to a previously unknown threat with unprecedented consequences. As the International Federation of Medical Students Associations, we deeply appreciate and commend PAHO's leadership on our member states' efforts in the short-term management of the COVID-19 pandemic. Nonetheless, the pandemic has demonstrated emerging needs and gaps in our healthcare systems, disproportionately affecting vulnerable populations that must be addressed urgently. Additionally, the current health crisis is culminating with a regressive scenario that exacerbates gender equality issues and the feminization of poverty. These challenges require targeted interventions to ensure they are considered and integrated in any emergency preparedness plan while ensuring their reduction. Recovery plans to support the most vulnerable populations, included but not limited to migrants, people with low socioeconomic status, unemployed and homeless people, as well as housing with increased risk of domestic violence or lack of access to basic services, should be prioritized. Expanding capacity to meet their needs in the long term is required. Thus, we underline PAHO's first line of action on strengthening leadership, stewardship, and governance, with establishment and implementation of policies and programs that mitigate the pre-existing adverse conditions and the ones that have been worsened due to the pandemic. As IFMSA, we are highly committed to achieving universal health coverage by providing dignified and non-discriminatory healthcare services, with a focus on removing barriers of access for vulnerable and marginalized populations. Therefore, we call the Bureau on member states to collaborate with non-state actors, non-governmental, and especially youth-led organizations to establish a comprehensive joint collaborative
Your time
strategy.
is up.
Muchas gracias.
Thank you very much. International Federation of Pharmaceutical Manufacturers and Association has the floor, to be followed by the National Association of Obesity. So, pharmaceuticals, please go ahead.
Thank you. The statement is on behalf of IFPMA with the support of the Latin American Federation of the Pharmaceutical Industry, PHARMA, and Pharmaceutical Researchers and Manufacturers of America. As essential global health stakeholders, biopharmaceutical companies feel a strong sense of responsibility to act together in partnership with international organizations, governments, and other stakeholders to mitigate the consequences of this pandemic. IFPMA is a proud founding partner of the ACT Accelerator and committed to its goals. From the start of this pandemic, we've worked to ensure there's no interruption in the supply of innovative medicines for patients. In finding effective and safe treatments and vaccines at record speed, the private R&D business model, enabled by sound intellectual property incentives, has significantly contributed to the discovery and development of treatments currently being tested. Our companies remain committed to the principle of equitable and affordable access to eventual COVID-19 related health products and call upon governments to do their part and ensure adequate resources are dedicated. Thank you.
Muchas gracias.
Thank you very much. The Global Federation on Obesity, and to be followed by the Heart International Federation, the Federation on Obesity.
Obesity federations commends to the World Health Organization and PAHO states for their action to control this pandemic. But we wish to draw attention to one important issue. Obesity is a chronic disease that is a risk factor for COVID-19 complication and mortality. Therefore, in the context of this pandemic, we urge government to embed the following consideration. First, ensure nutritionally adequate food for all particularly vulnerable populations. Second, restrict donations and marketing of ultra-processed food and breast milk substitutes. Third, ensure that policies and restrictions to limit the spread of COVID-19 allow for people to be physically active while maintaining safe distance. And finally, ensure that people living with non-communicable disease are tested early and have continued access to medication and treatment. Thank you, Mr. President.
Muchas gracias.
Thank you very much. We now give the floor to the Global Heart Federation, and the Association of Anesthesiologists will follow. The Heart Association, you have the floor.
Many thanks, Mr. President. The World Health Federation and the Healthy Latin American Coalition applaud the World Health Organization and PAHO's relentless commitment to science, solutions, and solidarity in fighting this viral storm. Heads of state and policymakers and non-state actors must remain united in their support for the crucial leading role played by the World Health Organization.
Tenemos problemas para...
We are having sound issues with you, madam. There is some background noise or interference, and it is not possible to interpret you.
Adelante, por favor.
Please try again.
A ver si the World Heart Federation started over. Should I start over?
Sí, por favor.
Yes, please.
Microphone is open and it's producing echo. If you could please lower the volume of your input, that might facilitate. And we can try again.
All right. Apologies. I hope maybe you can hear me. Maybe I'll speak less loudly. Will that work?
Let's try that way.
¿Estamos escuchando?
Try it. Okay. The World Heart Federation and the Healthy Latin American Coalition applaud the World Health Organization's and PAHO's relentless commitment to science, solutions, and solidarity in fighting this viral storm. Heads of state, policymakers, and remain united in the support for the crucial leading role that is played by World Health Organization and its regional committees. We recognize serious impact that COVID-19 is having on our patients with circulatory diseases. Patients with predisposed factors like hypertension and diabetes are at higher risk of dying from this virus. We urge you to consider the following specific recommendations. One is to include specific references to CVD and circulatory health and NCDs in the COVID-19 national plans. Another one is to provide coordinated research, training, monitoring, and evaluation of interventions directed towards people living with CVD. And support civil society engagement to ensure that government action is shielded from interference from the tobacco, alcohol, and food and beverage industries. We need leadership in global health, and now more than ever. Thank you, Mr. President.
Muchas gracias. Tiene la palabra la Federación Mundial de Sociedades de
I thank you
Anestesiólogos.
very much. The International Federation of Anesthesiologists is next, and Forgotten Diseases is after that. The Federation of Anesthesiologists has the floor.
Federación Mundial de Sociedades de Anestesiólogos.
The World Federation for Anesthesiology Societies.
Parece que no se encuentra. Tiene la palabra.
It would appear they are not present. I give the floor to the Initiative for Medication for Forgotten Disease. Thank you very much, Mr. President. The countries of this region have, without exception, stepped up to COVID-19 in hopes that vaccination and medications that are being developed will be distributed on the basis of a public basis, and we hope that to that end, the resolution will be strengthened. We need less fragmented and more transparent mechanisms where the production of technology is sufficient and where prices are affordable. We need the transfer of technology to generate new sources of production, because those that exist thus far simply won't be enough. And we ask that titulars share their intellectual property, and the cost of medication should be, the sale price should be as close as possible to its cost. It's important that the WHO Observatory have a role to play as well. We need to work on the difficulties of access to medication in the region. Thank you. The International League Against Epilepsy is next, and Pharmacology after that. International League Against
for Epilepsy appreciate PAHO, WHO, and member states' work to address the COVID-19 pandemic, while the acute needs of COVID-19 patients and the urgency to control outbreaks in recognize the needs of people with epilepsy have not been fully integrated into response. In response to an highly global COVID-19 survey, around a third of epilepsy patients who were able to access medication previously report significant difficulties with regular supply during COVID-19. Around a quarter report an increase in seizure frequency, and over a third are unable to access support from healthcare professionals. The above finding and concerning, since 70% of people with epilepsy could be seizure-free with treatment, the cost an average $5 per year. It is estimated more than 50% of people with epilepsy in Latin America and the Caribbean do not receive health care. Premature death in epilepsy times higher than in the general population. People with epilepsy face needless discrimination. This poor outcome and amplified by the COVID-19 pandemic throughout the Americas. It is also recognized that COVID-19 can present with new onset seizures. 5 million people with epilepsy live in the Americas. Their health and psychosocial needs and the importance of the increased research into neurologic impact of COVID-19 require urgent attention. The ILE and IV are willing to work with PAHO and WHO and member states to ensure these critical elements are integrated into the emergency response and provide a blueprint for future pandemic planning. Thank you.
Gracias, tiene la palabra.
I thank you. The International Society, the International League Against Epilepsy, and then nephrology.
The International League Against Epilepsy and International Bureau for Epilepsy appreciate PAHO and WHO and member state work to address the COVID-19 pandemic, while the acute needs of COVID-19 patients and the urgency to control outbreaks is recognized. The needs of people with epilepsy have not been fully integrated into the response. In response to ILE global COVID-19 surveys, around a third of epilepsy patients who were able to access medication previously report significant difficulties with regular supply during COVID-19. Around a quarter report an increase in seizure frequency, and over a third are unable to access support from healthcare professionals. The above findings are concerning since 70% of people with epilepsy could lie seizure-free with treatment that costs on average $5 per year. It is estimated more than 50% of people with epilepsy in Latin America and the Caribbean do not receive health care. Premature death in epilepsy is 3 times higher than in the general population. People with epilepsy face needless discrimination. These poor outcomes are amplified by the COVID-19 pandemic throughout the Americas. It is also recognized that COVID-19 can present with new onset seizures. 5 million people with epilepsy live in the Americas. Their health and psychological needs and the importance of increased research into the neurological impact of COVID-19 require urgent attention. The ILE and IVE are willing to work with PAHO and WHO and member states to ensure these critical elements are integrated into emergency response and provide a blueprint for future pandemic planning. Thank you.
The interpreter is not hearing the chairman.
Hello, my name is Jorge Cerdá. I'm speaking on behalf of the International Society of Nephrology. We wish to thank the Regional Committee and its member states for the actions taken on COVID-19 in the Americas. The ISN urges the WHO Regional Committee and its member states to recognize the impact of COVID-19 on patients with acute or permanent kidney failure, many of whom face interruption or unavailability of life-saving treatments such as dialysis and transplant. Preliminary data show that about 20 to 30% of patients hospitalized with COVID-19 develop kidney failure, leading to a surge in requirements for dialysis in the short and sometimes long term. We call upon member states and the PAHO to ensure a timely treatment of acute and chronic kidney disease, to ensure availability of adequate personal protective equipment to protect the healthcare of workers, and to ensure that patients with non-communicable diseases who are being affected by severe comorbidities, including diabetes, malignancies, and respiratory, cardiovascular, liver, and kidney diseases, commonly experience worse outcomes and are protected and treated from the consequences of COVID-19. Thank you.
Muy bien, muchas gracias. Damos paso a la Sociedad
Thank you
Latinoamericana.
very much. The Latin American Society on Nephrology and Hypertension have the floor. I'm Alejandro Ferreiro. I'm the president representing 10,000 nephrologists in the region. ASLAM and PAHO have worked very closely to against the impact of the COVID. We published an important article in our magazine and have followed PAHO and WHO recommendations, which our people have adopted, working on PPP, working on free training in nursing among more than 5,000 who had been retired. We worked to register more patients with acute renal failure and worked with Uruguay, and Argentina to assist patients on dialysis. More than 25% of these with COVID die. We've worked also to ensure that there's timely treatment for patients together with national societies and ministries, and we proposed to PAHO a plan that would ensure continuity of healthcare. ASLAN will be celebrating 50 years this year, and we work closely with non-state actors and the health authorities. But let us remember that we want to be sure that there is a good career path for all of us working in this field. Those who don't have access to treatment must do, and particularly with those with kidney disease and chronic kidney disease. We can only work together hand in hand with the health authorities of each country, aligned as we must be on the basis of those who founded our association. Thank you very much, sir, says the chair. We have now concluded the intervention of non-state actors, and I now give the floor either to Dr. Barbosa or Dr. Ugarte for their respective comments or responses. So either we have Dr. Barbosa. Thank you very much. I can get the ball rolling, says Dr. Barbosa. Here, Dr. Ugarte. Thank you, Mr. Chair. The comments we've just heard from these representatives are very well received. I would simply underscore that the organization and the Secretariat work very, very closely with WHO and numerous other partners, multi-sectoral partners, partners who share their technical and operational expertise and have done in their respective responses to COVID-19. And let me take this opportunity, Chair, to say to you and the distinguished members of this directing council that the staff of the organization of the Secretariat itself have been present and active from the very start of this pandemic, and that is a cross-cutting position. Every single area of this organization is involved. This work is not only technical, it is also administrative. And I would here highlight the fact that that work can only be carried out if we have transparent information forthcoming from each country. And that is why we can jointly respond to the challenges that arise and look at the suggestions to improve the resolution. We have an informal working party working on this, and I thank you very much. Thank you, Ciro, says Dr. Barbosa. Let me take this opportunity to express our thanks and my thanks to all the member states and indeed the associations that have taken the floor on this very critical issue before us. For each country, we can say there has been enormous efforts to respond productively to the pandemic, but we all jointly and severally recognize that there's yet more to be done. And we need to identify the gaps in our processes and how to move out of this situation as effectively as possible. We want to be sure that people have the right access and the appropriate access that they have had in the past to vaccination, to malaria, and to numbers of other situations. We will be looking very carefully on how best we can work more closely with national authorities to ensure that each one can face this pandemic and maintain its health systems best possible. Thank you, Dr. Ogate, says the chair. Madam Director, would you like to say a few words?
Certainly, Mr. President. And so let me begin by thanking member states for your many interventions today. I also want to take this opportunity to recognize the efforts that have been made by the countries of this region to prepare, confront, and fight this pandemic. The Secretariat has been both pleased and privileged to accompany you in this fight. As we have stated before, we must go forward fully cognizant that this crisis is multifaceted and demands an integrated multi-sectoral response. The Secretariat will continue to work with you to provide the evidence-based guidelines to support your policy decisions and actions at the national level. We will work with you to strengthen solidarity, fully aware that our many diversities affords a great opportunity for holistic development. We will work with you to facilitate the sharing of experiences and best practices to address the broad public health needs in our region. And we will work with you to facilitate access to technology, including vaccines, to build stronger, better financed, equitable, and resilient health systems. At PAHO, as you've heard from the Assistant Director, we have utilized an across the Secretariat approach, making the best of all the knowledge and the expertise that is available across all our many committed staff. We've prioritized essential health programs going forward, gender, ethnicity, and the populations in conditions of vulnerability. I must tell you as well that for several months now, we have launched a repository where we are collecting all the information on guidelines, the information on actions, the information on challenges, and what member states have done to advance those responses, and the lessons learned and the best practices. We believe that this also is a responsibility of this organization to have this data organized for history, but also for the use and benefit of the next generation. Thank you again as we go forward. I have no doubt that together we will successfully bring COVID-19 to an end. Thank you. Over.
Muchas gracias, señora directora.
I thank you very much, Madam Director.
Terminaremos la sesión de la mañana.
At this point, we will adjourn the morning session, and we'll give the floor to Monica for her to share some information in that regard. And we will pick up in our afternoon session at the time that Monica will inform us.
Mónica, adelante.
Monica, you have the floor. I'm so sorry, Chair. My assistant just stood up, I'm afraid to say. But here is what I have to share with you. It's on two issues. During the break that we have for lunch, there will be the second meeting of the working group to study the application of 6B, and the link for that meeting has been shared by the countries that are members of that working group, and that working group should begin at 1 p.m. this afternoon. That's the 6B article. The second working group meeting over lunch is the working group on the informal consultation regarding the COVID-19 and the Americas item on our agenda. The link for that second working group meeting has also been linked a couple of hours ago. It was shared with all of the heads of delegation and alternates of member states. So if besides the head of delegation and the alternate, any country wishes to have someone else participate in that working group, please coordinate amongst yourselves. The room will be open from 1 p.m. in order to be able to work from 1 to 2 over that lunch break. We will probably start the directing council plenary a little after 2. Thank you very much for this morning session. I think it has been quite intense and productive, and I can only hope that this afternoon session we will work just as well in order to move forward. I'll see you at 2 p.m. The meeting for this morning stands adjourned. Oye, Judith. Entonces ahorita me voy.
This report is structured on 9 pillars of the COVID-19 Strategic Preparedness and Response Plan. The PAHO Office for Barbados and the Eastern Caribbean countries activated its incident management team in February 2020. The office focused on 3 objectives: to save lives, protect health workers, and stop the spread of the virus. The incident management team visited Dominica, Grenada, St. Kitts and Nevis,